Hello, I'm Yesenia. If you're watching this, chances are you or a loved one has an intravenous line, commonly referred to as an IV. At Nicholas Children's Hospital, our foremost priority is ensuring patient safety and well-being. A crucial aspect of this commitment involves the implementation of the touch, look, and compare assessment method. This method, utilized by our healthcare professionals, serves to evaluate the condition of a patient's IV site, which is crucial for early detection of potential issues like infiltration, where fluids or medications leak into surrounding tissues, leading to discomfort and swelling. Fortunately, early detection through this method enables swift intervention, thus averting complications and upholding patient safety. Our dedicated healthcare team possesses the expertise to swiftly identify and effectively manage IV complications. The touch, look, and compare assessment stands as an indispensable tool in evaluating a patient's IV site, designed specifically to promptly detect any signs of infiltration. This is the unintended seepage of IV fluids or medications into nearby tissues. It can cause discomfort, swelling, and pose potential risks. Timely intervention is paramount in preventing complications, such as tissue damage and infections. While healthcare providers are primarily responsible for conducting these assessments, active participation from patients and their families is invaluable. Collaborative engagement ensures close monitoring and enhances patient safety. Therefore, your participation in the touch, look, and compare assessment is crucial for patients. Next, I will explain a detailed breakdown of the assessment process for IV infiltration. Touch. Assess by feel. Gently touch the area surrounding the IV site with your fingertips. Note any changes in the skin's temperature around the site. Infiltration can cause the area to feel cooler. Assess for signs of swelling, puffiness, or edema around the IV site. Observe for any discomfort or pain when the patient reports tenderness or during palpation. Look. Assess by sight. Visually inspect the IV site carefully. Examine the skin for any redness, discoloration, or blanching, skin turning pale. Scan for indications of bruising or hematoma formation. Check for the presence of blisters or any notable changes in the skin's appearance. Compare. Compare with the opposite side. For a more comprehensive assessment, compare the IV site with the corresponding site on the opposite limb, if applicable. Evaluate for symmetry in terms of temperature, color, swelling, and discomfort. Be alert to any noticeable disparities between the two sides, as they may indicate infiltration in the affected limb. If any of these assessments hint at the possibility of IV infiltration, it is imperative to take immediate and appropriate action. As patient family, how can you prevent IV complications? Reporting discomfort or changes. Patients and their families should actively communicate with healthcare providers concerning any discomfort, pain, or unusual sensations experienced at the IV site. If any alterations in the site's appearance or feel, such as swelling, redness, or coolness, are observed, they should promptly inform the healthcare team. Monitoring between assessments. In addition to routine healthcare provider assessments, patients and family members can conduct their own intermittent checks of the IV site. Gently touching the area and visually inspecting it for any discernible changes allows for timely reporting of concerns to the healthcare team. Asking questions. Patients and their families should feel empowered to ask questions about the IV procedure, its potential risks and benefits, and any lingering doubts. Seeking clarification on the purpose of the IV, the medications or fluids being administered, and what to expect during or after the procedure is encouraged. Offering emotional support. The process of IV placement and dealing with complications like infiltration can be emotionally taxing for patients. Family members can provide vital emotional support by offering reassurance and being present during the procedure and subsequent assessments. The collaborative approach among healthcare providers, patient, and family enhances the patient-centered care and ensures that any issues related to the IV site are addressed promptly and comprehensively. In conclusion, by working together, we create a circle of care and vigilance. Patient safety is our shared goal, and together, we ensure the best outcomes for every patient.